Okay, so on Tuesday, we were discussing, if I remember correctly off the top of my head, feedback and the different methods in which we perform it, which are negative and positive. Both negative and positive involve three components: receptors or sensors, a controller integrating center, which is most often a region in the brain, and then effectors, which are going to be typically muscles or glands. Okay. Did we talk about feed forward? Okay.
Yes.
Are we ready for? Is this where we're at right now?
Yeah, we wrote that one down, but we didn't talk about it.
Okay, that's what I thought. Okay, so that's how we maintain homeostasis. Something that we're constantly doing, always trying to achieve is homeostasis. Unfortunately, not always going to be achievable. And when one or more components of the body loses its ability to help maintain homeostasis, we call that a homeostatic imbalance. Okay. Now, as long as our body's control conditions remain within certain narrow limits, our body cells are going to function efficiently and homeostasis will be maintained. So in other words, we're constantly being subjected to states where we're not, 100% perfect. Never will we be 100% perfect. And I kind of hopefully drove that point home the other day. But our body's pretty darn good at getting by, thinking like a low grade fever, 101, 102, you're fine. As long as it's not too drastically hot as far as your fever goes, you're going to be just fine. If a homeostatic imbalance is moderate, though, a disorder or disease may occur. Now, these terms, disorder, disease, kind of get used interchangeably, at least commonly they do. Technically, they are not the same. A disorder is just any abnormality of structure or function. So when something's not working correctly, basically, okay? A disease is a more specific term for an illness characterized by a recognizable set of signs and symptoms. So, any disease that people suffer from, whether it's asthma, arthritis, osteoporosis, things that we'll talk about at various points in the semester will be some diseases. Now, the words signs and symptoms also get used pretty interchangeably, but they are not the exact same thing by any means. Signs are described as objective changes, whereas symptoms are described as subjective changes. The difference between objective and subjective basically relates to whether it can be measured or not. Okay, something that's measurable is objective, like you can see it. Okay, examples would be a fever. You can read the thermometer when you stick it under someone's tongue, like we used to do, or now when you scan the forehead, or when you walk in a building now, since they're all over the place since the pandemic. Swelling kind of sounds weird, but you can actually measure swelling. Take a tape measure and wrap it around it, a swollen ankle, and then compare it to the other ankle that's not swollen, and you can see big differences that exist there. Other examples of signs would anything that's measurable. So like when they put the little doodad on your finger when you go to the doctor, they're measuring your oxygen content in your blood. It's called a pulse oximeter. Taking your blood pressure, your heart rate, that kind of stuff. Symptoms are non-measurable substance or changes, things that we experience like headache, nausea. You can't measure, pain, for example. Now, commonly asked thing is, okay, you're hurt. How bad does it hurt? Give me a number on a scale of 1 to 10. Okay, Avery says 6. Is that going to be the same as Aspen 6? I don't know. Okay, everybody's different in how they experience these subjective things. It's variable from person to person. Okay, so signs, symptoms, not the same. Keep that figured out in your brain. Now, those are all examples of moderate imbalances. Unfortunately, there are conditions in which severe imbalance can occur, which may result in death. Now, I always say this, and it's kind of a weird thing to say, but it's really true. It's really hard to die. Kind of a weird sentence for me to say, but it's true. The human body, we are amazing in how we adapt and survive. Like we talked about the last 2 days, we're constantly being affected by things that change us. We're constantly being thrown out of balance. Okay. Now, wonderfully, we live in the year 2022 with the advent of modern medicine, with obviously vaccines. and antibiotics and different things that have really extended the lifespan of individuals. But even before that, we're pretty darn resistant to death. So it's hard to die. Weird to say, but it's true. Okay, now speaking of modern medicine, something that we've all had done to us, going to the doctor, we're not feeling very good. I imagine everybody's been to the doctor when they are sick, is going to the doctor and having to try to figure out what's wrong with you. Okay. What the doctor and the medical team is performing and what you may do in your future career, sounds like a lot of you guys are getting into the nursing field, is working on making a diagnosis. Diagnosis is a science and skill of distinguishing one disorder or disease from another. So figuring out that it is asthma versus chronic bronchitis, or that it's osteoporosis and not bone cancer or something like that. Okay. A patient's symptoms, signs, their medical history, a physical exam, and lab tests provide the basis for making a diagnosis. A medical history consists of a collection of events or information about events that might be related to the patient's illness. This is going to include the chief complaint, which is, the primary reason why that person is actually going to the hospital or seeking medical attention. If they got a nail sticking out of their leg, pretty obvious. But, if they're feeling nauseous, like I said, you can't see or measure nausea, so the person would have to describe it. Okay. History of present illness, like how long have you had it? What have you been doing? Have you been throwing up? Have you, when you stand up, feeling dizzy, stuff like that. Past medical problems, family medical problems, your social history, and a review of symptoms. And then a physical exam is going to be done. Physical exam is an orderly evaluation of the body and its function or functions. This process involves non-invasive techniques of inspection. So this is like when the doctor has you open your mouth and say, "Ah," they look into your nose, into your ears, in your eyes. Okay, they're viewing, inspecting. Okay, palpation, not to be confused with palpitation, which is an irregular heart rate. Palpation is like when the doctor touches and feels your body, and they're checking for lumps and that kind of stuff. Like when you go to the doctor and you're feeling sick, they come and they feel your neck. They're checking to see if like your lymph nodes in your neck are inflamed. Auscultation is a fancy word for listening to sounds of the body, commonly known with a stethoscope. The stethoscope, they put it on your chest, they take a deep breath in, they put it on your back, doing different things to hear what's going on inside. Percussion, if you've ever heard that term before, you might be thinking like drums in a band. Okay, doctors will tap on the body and look for different things. A common thing that we have done when we're kids, especially tapping on that patella tendon, check to see if your leg will kick out in response. Okay, so those are all physical exam processes, along with other things like measuring vital signs, so that checking your heart rate, blood pressure, that kind of stuff. And then lab tests, which are things like, peeing in a cup to check your urine content, taking blood, very commonly done lab tests to check for, whatever's going on in the blood. And you haven't really kind of ever thought about it. A doctor is a scientist just going through the scientific method. Okay, I'm sure you guys all know what the scientific method is. You're exposed to a phenomenon, you observe it, you make a hypothesis, you test the hypothesis, you record the results, you come to a conclusion, right? Okay. Well, when you go into the doctor, you tell them these things, they check you, they look inside your mouth, they listen to you breathe, they're doing all these different examinatory things, or examinations, examinatory is not a word, examination things, okay? Because they're performing a test, okay? And once they've gathered the results, then they make a conclusion. You have coronavirus, you've got the flu, you've got bronchitis, okay? So that's the scientific method in a very clinical setting that, as a nurse or as a physical therapist or, any individual as part of the medical team, you might be taking part in. So it's kind of cool. All right, last thing I will just touch on is gonna wrap things up for this lecture, discussing the 4 key themes that are going to appear in this class. Some of them we've already really talked about quite a bit. Homeostasis, number 1, maintenance of relatively stable conditions in our body's internal environment. It's the backbone of the class, so because it's vital to normal function of the body, it's the most important theme of physiology. Integration, we defined that earlier, when several components work together to accomplish a particular function. That was, back when we were looking at that figure with all the different systems connected by lines and arrows, and I kind of compared each system to a player on a football team. But it's not just systems, essentially all components of the body, whether it's molecules, cells, tissues, organs, and organ systems, they're working together at various levels to keep our body alive. Mechanism of action explains how the body works by indicating the mechanisms that are involved, because this is a way that the body function is explained. It's a prominent theme. And then communication, cells of the body must communicate with one another in order for the body to function. We talked a lot about input, output signaling with regards to feedback. That's, signaling is just another way of saying communicating. So those are the kind of 4 most prominent themes that we will cover in this class.